And according to health experts, global health funding approaches politicization of the pandemic, including political blame game, mistrust of government and other institutions, and a lack of robust accountability measures are some of the pandemic response obstacles. But they also say that COVID-19 has presented an opportunity for a collaboration that may potentially strengthen global solidarity. Where is Nigeria with its capacity-building institutions and agencies in tackling the pandemic and other infectious diseases? Well, joining us is a public health physician, Dr. Alero Roberts, who joins us virtually. Welcome to the program.
Thank you very much for having me.
So the COVID pandemic threw up gaps in Nigeria's health system, as with a few others around the globe, but defining essentially a new direction that countries must take to achieve self-sufficiency in pharmaceuticals or research, name it. So far, what have you seen that we are doing in this regard?
That's a very good question, and one that has had us thinking quite a bit in the last few weeks and months. The gaps that the COVID-19 pandemic showed up in the health system are really rather cogent. And the problem is that when we're now looking at this 2022 health budget, the real issue is going to be human resources for health. How do we continue to retain them? How do we recruit them? How do we retrain them? How do we remunerate them? Because there's no doubt that the loss of our human resources for health to higher income countries or places with better working conditions is really quite dire. And this is across board. This is not just talking about the doctors. We're talking about the nurses, the physiotherapists, the pharmacists, the medical lab scientists. We're losing them all. And I would honestly wish that if I had a magic wand, we would seriously deploy at least the Abuja Declaration 15% of the budget to the health sector so that the entirety of the health sector can be strengthened.
But with regards to what you've mentioned, human resources, that also is affecting some of our institutions because then they are leaving those institutions maybe almost empty. So in terms of perhaps what we must do, a lot of the times, I think we've said that there have been multiple healthcare policies, several interventions from government, private sector. But how do we bring all of these interventions into reality?
The truth of the matter is we just need the administration to keep their promises. There have been enough policies that have been formulated. You can't implement a policy without people. And, you make a promise to people and you don't keep it, and you do that consistently time over time, you completely erode the trust people have in any institution or in any administration. And therefore, you have massive, beautiful teaching hospitals all well laid out and no people to staff them. The administration simply has to keep their promises. MOUs that have been signed, agreements that have been signed need to just be kept. It's very simple.
Now, looking at some of these agencies, and this is in the wake of, zeroing in on how we've handled COVID-19 since our first case, how would you say they've performed? NAFDAC, NIPRID, NIMA?
Without the data, it's very difficult to say. I'm not going to sit here and speculate and say they've done well or they haven't done well. In terms of, NAFDAC has done well, to be honest, because they've been really up to par on checking the validity of the vaccines, checking the validity of treatment claims, and debunking when they need to be debunked, and debunking them quite seriously based on science. We've probably done a lot better than expected, particularly in the production of healthcare consumables because of the jam we had in the logistics supply chain. But without cogent data that has been published, it's very difficult to make a statement and say, yes, we've benchmarked against international organizations, we're here or there. So I won't speculate, no.
Okay, to quickly get your thoughts as we wrap up, NIPRID recently told us 2 out of 4, I think that's the medicines, for the treatment of COVID-19 are undergoing clinical trial. Are you optimistic about this?
Oh, very optimistic, absolutely. because they'll be doing clinical trials according to international protocols. Nobody would dare do anything less than international best practices. So yes, I'm very optimistic about it. And the next question is whether we can produce it in country. That would be absolutely fantastic if we can produce them in country.
All right, Dr. Lara Roberts, thank you so much, and be safe as you head onwards. Thank you so much for joining us on the program.
Thank you very much. Okay.